Got questions about ostomy care? We've gathered the most frequently asked question to give you the answers you need. Two-piece pouches for urostomy, preventing stool leaks on wafers, driving with a colostomy, itching from stoma adhesives, using moldable rings to avoid pancaking, how often to change an ileostomy pouch. Let's clear your doubts and make ostomy care easier.
I find the advantage to the two-piece is it's easier to see how you're placing your wafer. So especially for somebody who maybe has some vision issues and has trouble seeing very well, the two-piece is going to be more practical and easier because they can look in that mirror and see. I do find that some family members who are providing stoma care also find that easier to do, especially when they're new. When you become a pro at it, because you've had your stoma for a long time, I do have patients that use a one-piece tan pouch so they don't have to see how they're placing it. But the biggest benefit to it is getting that good placement of the wafer portion of your pouch. But if it's leaking, then we need to really look at why is it leaking? Is there something wrong with your fit? There are a lot of people who complain of something called pancaking. And what that means is their stool comes out, but it doesn't fall into the pouch. It will kind of sit around at this top portion. And when that happens, because it's not sliding down into the bag, it can start to leak underneath at the edge of this. So for somebody with that, I would probably recommend you using either a paste or a moldable ring, and maybe consider using your lubricating deodorant so that when you empty your pouch, you want to make sure the top part here is lubricated nicely because it's oily. So that gives a little more opportunity for the stool to fall into the bag. If that's not working, then, usually people who get pancaking, the stool is thick and pasty. So you want to either work on getting more fiber in your diet to make the stool more firm, which will make it come out in one piece, and it's much easier to clean and take care of. You won't have this pancaking. Or you could do a stool softener to make it a little bit looser so that it will fall into the pouch. Those are your other two options for helping with that. You can do anything you did before having your stoma. So truck driving, absolutely. I guess your biggest concern would be is if you have the ileostomy and you have to empty your pouch frequently. They do actually make little packets that you could put in your pouch that would help gel it so that it's not as liquidy. But and being a truck driver, if you do heavy lifting, with that, because a lot of people do, I would recommend you get that support belt so you have that to help with the peristomal hernia. But yeah, go back to truck driving, go back to swimming, go back to climbing rocks, go back to hiking. It's all good for you. Number one, you could be sensitive to the material that the barrier is made from. Hollister makes a product with ceramide in it. Ceramide you're going to find in like beauty products. They help rejuvenate your skin and make it better. So if you're having a problem and you're reacting to the actual adhesive here, I would recommend trying Hollister's ceramide line. They make them in flat, they make them in one piece, they make them in two-piece, they make them with convexity. So that would be the first thing. The other thing I think about is, because your skin is covered all of the time and it doesn't really breathe, sometimes you can develop a little bit of a fungal reaction, and getting an antifungal powder that you could place on the skin instead of using, say, stoma powder. You would use the fungal powder and then use your barrier spray over that so that your product can stick, and that may help with that itching. If you've tried the moldable ring and it's not working for you as far as the pancaking goes, I would try the fiber either, and you know, depending on why you have your stoma. If you have Crohn's disease or something like that where you can't have a lot of fiber, then I would recommend you use the stool softener and make the stool more loose so that it's not sticking at the top of your pouch. But if you have a colostomy and you can have fiber, adding that fiber to bulk up the stool is going to make that problem, well, hopefully, go away.
Okay, very good. We get asked this question a lot, Christine. Does HPFY sell the wrap? Where can I find it?
Okay, so there are actually multiple kinds of wraps. Again, this particular one, which has a really nice material, is made by a website called Ostomy Secrets. Excuse me one second. But HPFY does carry other wrap type products, and I have one here. It's made of slightly different material, but it does have a hole on the inside to put your pouch through, and then you wear it just the same way you wear the other one. So that we do have on our site as well.
We don't have access to the Ostomy Secrets line, so that would be something that you go directly to them for. It's a direct relationship that we don't have access to. But if it's something that you enjoy and that would work well for you, you could go directly to Ostomy Secrets. Next question. I have a hernia at my stoma site. Is the support belt that you showed the best support? Where can I get one?
There are a few companies that make the support belts now. As I mentioned, this one is made by New Hope, and they do make multiple ones. You can see this one is it's got some see-through pieces. Some of them are more breathable. They come in 3-inch, they come in 4-inch, 5-inch, 6-inch, 9-inch. Depending on how big you are, how tall you are. We do have those, I believe, on our website. Coloplast makes one. That's the binder, and it's got a specific area that you would cut to fit your pouching system. That is on the HPFY website as well. I recommend you change it every 3 days. So if you're getting 5 to 6 days with an ileostomy, that's great. 4 days probably I would recommend as the maximum, for the simple reason of you don't want to wait for it to leak. You want to be proactive so that your skin's not coming in contact with those digestive enzymes in the ileostomy output. So kudos to you. You're doing something right that you got that many days with it, and that's wonderful. But typically, maybe you want to consider going every 4 days just so that you're keeping your skin in really good shape.